And so we know inauguration is going full throttle. We know that there's going to be people performing, there's going to be bands marching. And so we're hoping and we're speaking into existence that nothing happens. But it's one of the drawbacks of when you allow people to spread misinformation and disinformation. So I think in the coming weeks, we're going to have those conversations of how do we regulate speech in a free speech society when people want to lie, right? And people want to spread false information. And what do you do, especially during a time of COVID-19, when misinformation is literally causing people to get sick, to take remedies that are making them worse off? We still had a time when people thought they were supposed to drink bleach, to prevent COVID. And so we really have to have those conversations. And hopefully people are taking some time to self-reflect and figure out where they individually went wrong this past couple of years, and are trying to have those deep conversations and understanding it and try to find ways to get better and more accurate information.
Absolutely. And we'll talk a little bit more later in the show about just all of the vetting that's going on in the military and in law enforcement, trying to root out insurrectionists within American law enforcement and within folks in white nationalist groups and other fringe organizations, part of law enforcement and the military. So this is a very interesting time. And we're going to talk about that a little bit later in the show. But now we're going to go to our first guest, the illustrious Dr. Amesh Adalja, senior scholar from the Johns Hopkins Center for Health Security, who's been featured on NBC, CNN. If you have cable and you're following COVID, you've seen him on from Andrea Mitchell to Rachel Maddow, to all types of folks that are just household names, in media. So Dr. Adalja is an old friend. Not only is very engaged, obviously, and an expert in health issues, but also is very interested in politics, and occasionally will hit me up time to time for questions about Star Wars, which is really cool as well. So we're very, very, very proud to have Dr. Amesh Adalja on. Thank you for joining us tonight.
Sure. Thank you for having me.
Awesome. So I'm going to pass it over to my great colleague, Miracle. Do you want to start with the first question?
Yes, Doctor. Thank you so much for joining us. So we've seen the past week and a half an expansion of the national rollout with the vaccines, and some discussion on who gets it, who should get it, who have a priority. What are some of the questions that you are seeing that people have with this national rollout, and some of the mistakes or learning lessons that there are so far?
The biggest question people have, and I think it's the right question, is when is it my turn? Because everybody knows that this vaccine is the way that we get out of this pandemic, and everybody is anxious to get this vaccine, which is a good thing. We want people to embrace vaccines. But the rollout hasn't been perfect, and many of us predicted it was going to be difficult going this last mile, turning a vaccine into a vaccination, because we saw, for example, back in the 2009 H1N1 pandemic, that there was difficulties with states actually implementing a vaccine program. You've got to remember that health departments are under-resourced, undervalued, and they are, at the same time that they're trying to roll out a vaccine program, they are also trying to deal with COVID contact tracing and set up testing sites. So this wasn't something that was going to go off flawlessly. And we've basically seen the federal government abdicate responsibility. And that's why this rollout was much slower than anticipated. And lots of misinformation and transparency that was lacking between the federal and state governments. And we really needed this to be planned for much earlier than it was. And I think we're starting to catch up, but it's really another example of how this pandemic response has gone wrong.
Interesting. Quick question about West Virginia and Alaska. Over the last several weeks, people have talked about how much better, and particularly West Virginia, which is very close to where we're at, saying that their infrastructure of mom and pop, pharmacies and vaccine distribution centers somehow give them an advantage over other states that may have the influx of Walgreens and CVS. How much of that do you attribute to that, or is it potentially something else that makes that's making their process go a little bit smoother than everywhere else?
I do think West Virginia is an example we all can learn from. What they did is exactly what you said. They relied on independent pharmacy chains because they don't have all of the major national chains there, and they got them prepped early before they even had the vaccine, so they could jump into action as soon as the vaccine was available. And I think they're a leader in the country for a reason. And they're not just with COVID-19 leaders; they've been leaders with other vaccines as well. If you look at the rate of vaccination for measles, mumps, rubella for kindergartners, it's one of the highest in the country in West Virginia. So this is something that they've been good at, and I think we should learn from it. I think that what we've seen, for example, in Pennsylvania, is very heavy reliance on healthcare systems, and healthcare systems are trying to vaccinate phase 1A, the healthcare workers there, and then you see the nursing homes being vaccinated by the chains, and that takes some time to speed up. And I think we're getting faster, but we're not going as quickly as we need to. I think Israel is the country that we should all look to, where they're using mass vaccination centers in order to really move people through. But there's a lot of bureaucracy involved in getting a vaccine. You have to sign up for an appointment. You have to sign a consent form. You've got to fill out your vaccine card. You've got to sit there for 15 minutes after you get your vaccine. And then you've got to repeat the whole thing in 3 or 4 weeks. And that's just not something that we're very good at. And I think that it's really now, it's kind of like do or die, because we're in this race with this virus. There's a new variant that's more contagious. So the quicker we can get this vaccine into people's arms, the quicker this is over. And I think we have to have an all hands on deck, war-like approach to getting vaccine into people's arms.
Sure. And I do definitely want to talk about the variant, but you are someone who has been vaccinated. You have gotten both shots. Can you just talk a little bit about your experience for those watching tonight who may want to get a vaccine, or many of those we know who are still concerned. They see like stories about what happened in Norway with some of those elderly patients that died after getting the vaccine. Could you just talk about your experience with getting the vaccine and any potential side effects, or sore arms or anything that came with that?
Sure. So I got my first dose of the Pfizer vaccine about 4 weeks ago. My first dose was completely simple. I didn't even have a sore arm. I went to work the next day, no major issues at all. The second dose came 3 weeks later, and as many people had, I had more side effects with the second dose than I did the first. But those really were headache, muscle aches and pains, a little bit of a sore arm. Lasted about 18 hours or so. I took a Tylenol, and I still went to work and did a night shift the day after my vaccination. So it wasn't something that was disruptive to my life, and I think it was well worth the benefit of the vaccine, considering that I take care of COVID patients every time I'm in the hospital. So this was something that I really wanted to have, and I think that this is a very safe and a very efficacious vaccine. And the risk-benefit ratio does favor the vaccine in almost any situation. What happened in Norway, and I think this is important, is just because you got a vaccine and something bad happens to you afterwards doesn't mean the vaccine caused it. There are people, especially when you're vaccinating nursing home patients who are very frail, have other medical problems, like what happened in Norway, that some of them are going to die just as part of their natural history of their lives. And you can't blame it on the vaccine. And there was no direct involvement of the vaccine in what happened in Norway. And I do think that this is something we need to talk about, because people are going to be vaccine hesitant, and there is an anti-vaccine movement that's going to jump on these types of incidents and really try and shatter people's trust in this vaccine. And you have to remember that these vaccines were made very fast, but not because they skipped steps or because they cut corners, but because they used new technology that wasn't there even a decade ago. And a lot of us, even prior to this pandemic, had been advocating for vaccines made using this technology called mRNA vaccine technology, because we knew that they would be so easy to get into clinical trials because of the simplicity of the technology involved. So the fact that these happened so quickly, that we got a vaccine in less than a year, is something to really cheer about, not something to be fearful about. And everything I've seen about these vaccines shows them to be very, very, very safe and really worth the benefit, because we're talking about COVID-19, which is killing maybe 4,000 people every day. And this vaccine is an easy solution to the problem, and it is actually the only solution we have in the United States to controlling this pandemic.
Absolutely. Miracle?
And so I will think like how you were talking about some of the issues with Norway and people being educated about these vaccines. Can you go a little more like in depth of where people can go to research more about the two different vaccines that are readily available right now, and some of the questions that they should be asking themselves as they do their own independent research?
I would say the best resource to look up the vaccines, the Moderna and the Pfizer vaccine, is the CDC website. There's a lot of information there for the general public comparing the vaccines, who should get vaccinated, what signs you should worry about, what side effects to expect. And I think that people need to think about, where do they fall in the priority group? Is the vaccine available to them in their area? And then think about getting it. And I recommend the vaccine to basically anybody. Pregnant women, people that are on chemotherapy, people who've had a transplant. This vaccine is going to be life-saving for them. So it is something that I recommend. What people should be asking is, if they've had allergies to vaccines in the past, they may want to talk to their doctor about it. But again, when you get the vaccine, you're asked to stay there for 15 minutes to make sure you don't have an allergic reaction, so that they can intervene. And all of those allergic reactions that have occurred, maybe about 24 or so, have been easily treatable. So I think that there's not a major issue with the vaccine. And I think it's something that we want people to get, and we want to make it as easy as possible to get. And I think it's something that you can really find a lot of information about. But if there's any questions you have, I think your doctor is a good source as well if you have specific health concerns. But in general, there's not really any exclusion criteria. People we wouldn't want to get the vaccine unless they've had an allergic reaction to the first dose. We may not want them to have the second dose. But again, these are very, very safe and effective vaccines, comparatively speaking.
Yes, and Dr. Adalja, could you talk a little bit about the variants? I know there's been a lot of talk about, there was definitely fear that it potentially be more virulent, but from what I've read, in this case, the fact that it's more contagious could actually make it more dangerous than if it was, the same level of contagion but more virulent. Could you talk a little bit about that?
Sure. So it's really important to remember that viruses mutate all the time. And COVID-19, or SARS-CoV-2, the virus that causes COVID-19, has been mutating since it appeared in humans. Most mutations don't do anything to the virus, but there are some that can change the function of the virus, how it behaves. And what we've seen with the UK variant, which was first described in September in the UK, but really rose to prominence in December when the UK had a spike in cases and they found that this variant was responsible for a lot of those cases, was that they looked at the mutations there. And those mutations seem to make this more contagious, makes it more transmissible, meaning that you're more likely to get infected with it if you're around somebody. It doesn't change the virulence, meaning it's still as deadly, or it's not any more deadly. It's the exact same virus. You don't change any of the treatments or any of the protective measures about wearing a mask, washing your hands, trying to avoid crowded or congregated places. And all the data shows that the UK variant is something that our vaccines are robust against, meaning that the vaccines will work against it. So there's no reason to worry about that. But what the variant really means is we've got to be better at all of those common sense recommendations that I said, that we can't let our guards down with this variant. And it's also a major push to get the vaccine into as many arms as possible, because we're sort of in a race with this variant and our vaccination program. So the quicker we get the vaccine into people, the less this variant is going to matter. And there's going to be new variants that pop up after this. And we always have to track those variants and test to make sure that our vaccines work against them, that our drugs work against them. But it's nothing to be panicked about, but it does add urgency to doing everything we're doing right now, as well as accelerating the vaccination program.
Miracle?
And so from the chat, a person asked, when you're vaccinated, does the research show that you can still be a carrier of COVID-19?
So this is a little bit of a controversial question. So we know that the vaccine is really, really effective at preventing symptomatic disease, but we don't have much data on whether or not it prevents you from getting asymptomatic infection. But biologically speaking, it's going to decrease your ability to be a silent carrier. We don't know the magnitude of it yet, but I think that those studies are going to be done, and I think that's going to change public health guidance eventually. But for right now, we're not recommending people change their behavior if they've been vaccinated because of this theoretical risk. But to me, biologically speaking, I think that this vaccine is likely to decrease transmission as well as decrease the ability to have severe disease. And I think it's just going to take some time to do the studies to be able to say that definitively. But I think if you've got two vaccinated people that are together, there's not really that big of an issue. But when you're around unvaccinated people, you should still follow those same recommendations until we get more data to say this definitively. But most of us believe we will have that data at hand soon.
Right. And in our last couple minutes with you, could you talk a little bit about, before the rollout, there was this discussion about a very strict kind of pecking order, for lack of a better term, where Group 1A, Group 1B, healthcare, and as we're seeing, that's somewhat breaking down around the country. And I believe even you, in a recent news appearance, you talked about the importance of not adhering strictly to that strict kind of pecking order, but getting folks who are interested in getting vaccinated up in the line and not kind of getting stuck with folks in the healthcare community or folks in other priority groups that have shown an unwillingness, or you said that vaccine hesitancy. So how is this going down, and should we just try to get vaccine to people who want it as opposed to the folks that we think may be most susceptible to the harshest effects of the virus?
So the priority groups are really important to put together because we were trying to maximize the impact of the vaccine, which was going to be a scarce resource. And I think we should still have a good faith effort to try and stick to the priority groups because we know elderly people, healthcare workers, nursing home residents, they're the ones that are most at risk. The nursing home residents, for example, make up the bulk of hospitalizations, and we're really worried about hospital capacity. But what was happening was people were in a position where they were afraid to vaccinate outside the priority group. Maybe they had some leftover doses at the end of the day, and they thought, let's just vaccinate other people because we don't want to put this vaccine in the trash can. But the priority people were getting very dogmatic about the priority groups, and that was making it very hard in order to actually get the vaccine into people's arms. And that has to be the overarching goal, is to get people vaccinated. So if priority groups are an obstacle to getting people vaccinated, I think we have to think about, are people too dogmatically adhering to them and really afraid to go around them? And there were places like, for example, in New York where Governor Cuomo said he was going to fine people if they went outside of the priority group and take their license away. And I don't think that's a productive thing because we don't want vaccine in the trash can. That has to be the absolute priority, that vaccine gets into someone's arm. At the end of the day, if you've got to vaccinate somebody that's priority group 1B or 1C or not even in any priority group, that's better than the vaccine going in the trash can. And I think we have to see flexibility in the way we vaccinate. And I think we're starting to see that with now people above 65 being cleared to be vaccinated, because the goal is just to get this pandemic over with. And that's going to happen the more people are vaccinated. And we want to stick to the priority groups as best we can, but we can't let perfect be the enemy of the good.
I'll leave the final question to Miracle.
Yes, and one of the questions we had from the comments is, how likely is that one of these new dominant strains will be resistant to the vaccine? And if so, what would the next procedure be for people who now have to deal, who've already been vaccinated, but now have to deal with another resistant strain?
I think it's very unlikely that one of the variants is going to be completely resistant to the vaccine. You might see some decreased efficacy. Maybe it drops down from 95 to 90% or 85%, but it's very hard for a virus to completely evade a vaccine. Remember, a vaccine doesn't just make one antibody for you. You get a whole host of antibodies, as well as stimulation of another whole arm of your immune system called T cells. So it's something that I think that you're going to see vaccines be very robust against these variants. But imagine, in a thought experiment, that maybe one of these variants was resistant to the vaccine. What would you do? The fact is, we use some really great technology. You could just update the vaccine very quickly if that's necessary. That's kind of the one of the benefits of the mRNA vaccine platform, that you can just update the vaccine very, very quickly if you needed to. But I don't think that we're there yet. I don't think we'll get there. I think that our vaccines right now, all evidence points to them being effective against both of these variants, and I think we'll get control of this with our current vaccine.
Awesome.
Thank you.
Yeah, we want to thank Dr. Amesh Adalja for sharing your wisdom and joining us. I mean, you're on Andrea Mitchell and CNN and all these very illustrious shows. So it makes us feel good that you took some time for us and just to spread your information. And you're such a wealth of information, not only for the world, but the fact that you're here in Western Pennsylvania. You're a great local treasure for us. And unfortunately, you have to, we need you at this time. We wish we wouldn't, be in a time like this where we would need your expertise, but we're glad that we have it. So thank you for joining us. Looking forward to talking to you again soon.
Sure. Thank you for having me.
Awesome. And that's Dr. Amesh Adalja from the Johns Hopkins Center for Health Security, senior scholar, sharing his infinite wisdom about COVID. And again, if you have cable, you saw him on many, many national news shows talking about this. So one of the foremost national experts on this. So wow. That was a lot of, really great, information. I mean, he was just dropping knowledge. I mean, what can you say?
I know it's always great to have doctors come on. And of course, if you want to hear more from the medical professionals, Thursdays at 7, we do have Ask a Black Doctor who will be following up, talking more about COVID and vaccines. And I think also we do have Ryan who's going to pop in the conversation and join us. But there's so much going on with COVID. So it's like, it's changing like every day. And so it's always great to have doctors who are very personable and relatable and who are willing to take the time to explain and answer questions about, the vaccine and the virus.
Absolutely. Yeah. And Ryan, before we go to our next guest, can you just give us a quick breakdown of, what happened today and and then we'll go into our next guest.
Absolutely, yeah. So today for MLK Day, National Day of Service, we alongside a bunch of other great organizations, APA, Take Action Mon Valley, several other groups, PICB, Black Lives Matter Southwest PA. We were at Black House Collections today. We organized a food drive for MLK Day and the National Day of Service. We were very grateful to get a really substantial donation of food boxes from the Greater Pittsburgh Community Food Bank, as well as a bunch of other, loose donations of food and other essential household goods from all sorts of people around the community. So we were able to distribute a ton of those food boxes. I think we distributed, well over 300 of those boxes today, in addition to, bags and bags and bags of other goods from community donations. So that was really fantastic to see. We had a ton of people come through and pick up boxes. We had a ton of great volunteers that were able to drive and deliver boxes and other goods to people who couldn't make it out to the food drive today, but still, were facing food insecurity and needed access, to those essential things. So it is really encouraging. We had a lot of great volunteers, a lot of organizations involved with it. And it went really smoothly, thankfully. We had a better turnout than expected. We got some good press and some good media coverage on it that really helped the turnout, as well as just all the groups who are involved with it, spreading the word, putting on social media, etc. But yeah, it was a really, really great event. And I'm happy I was able to be involved with it.
Awesome. Yeah. And shout out to all the organizations involved, and thank you, for your work. And now we're going to go into our next guest who's been in the news a lot over the past 2 months. And that's State Senator Jim Brewster, representing Allegheny and Westmoreland County, recently won re-election by 69 votes. For anybody out there who does not believe that a vote counts, man, ask the candidates that ran in the 45th Senatorial District this past year, and they can tell you all about the importance of every single vote being counted. Senator Brewster's win was challenged by his opponent on several occasions, and very recently it was upheld in federal court. So he has been seated. There was a ton of controversy. We had Lieutenant Governor John Fetterman on last week giving his perspective. So we're very, very honored to have the officially reelected state senator from the 45th District of Pennsylvania, Jim Brewster. Welcome to One of Power Hour. Thank you for being here.
Well, thank you for having me. Good to see everybody.
Awesome. So as we usually do, Miracle, you want to start off with the first question?
Talking about a process that did not go smoothly. But for the past, few weeks, you have been fighting to be seated. You knew these challenges were going to come. Did anything surprise you? Or were you expecting the challenges and not to be seated on the first day?
I wasn't surprised at how it went. I was disappointed that we put the public through this process. I mean, for those of us who are actual candidates, and for me in particular, I mean, I was a former mayor of McKeesport and spent almost 30 years working in one of the largest financial institutions in the state. So I'm used to being around people and servicing people, and I was just heartbroken that the 250,000 people in the 45th district didn't know who was going to be their senator. And, and as Carrie, if I misstating your name in the wrong way, you mentioned,
problem.
Is that close?
Kari,
okay.
Yeah, no problem.
When you mentioned about every vote counting, being in the Democratic caucus with Senator Costa, Senator Hughes, and Senator Williams and others, we talk about every vote counting. That's important to us. That's just not a statement that we make. It's just not a soundbite. It's something that really means something. And to think that another candidate, and this happened on a national level as well, to think that somebody would think just because we changed the process and you can mail in your vote, that you suddenly should be questioned more than someone who went into the poll. And to think that in Allegheny County, someone would think that 2,349 votes shouldn't be counted is simply unacceptable. And what the public, I don't think, grasped right away, because nobody would tell them. Those votes were Republican, Democrat, and Independent. They weren't just Democratic votes. It wasn't like Jim was trying to count votes that the other person couldn't get. And of that number, only 311 were in the 45th district.
Wow.
And of those 311, my opponent got a third, and I got 2/3. That's the election. At that point, we end up with 69 more votes. And I know that one judge did tell her attorney, if you want equal protection, count the similar votes in Westmoreland County. There were about, I think, 341 where there was no date written. Of the 341, I think there were about 35 in our district. Well, the judge said, well, if you want equal protection, instead of us disenfranchising 2,300 people, why don't you just count those 341 votes? And they said, well, we'd rather not do that. So, trying to manipulate the legal process to take away people's right to vote. Now, keep in mind, and this, I'm preaching to the choir. These ballots were sealed, completed, in the security envelope, in the outer envelope, and post-dated and dated that they've received on time. The only thing a few people didn't do is handwrite the date on. And right. To me, and I made this comment to one reporter, I said, it bothers me that anybody trying to get these offices, that they would openly try to not count a vote because somebody made a minuscule mistake. It wasn't like it wasn't signed. It wasn't like it wasn't completed. To think that you would take that away from someone just so you could win an election, to me, is a real good reason not to vote for that person. Because right. We talk about transparency all the time. Well, that's pretty about the opposite of it. And I just was really disappointed that occurred.
Absolutely, and we'll go to Ron for the next question. But I did just for those who are tuning in to understand that the claim was to throw these votes out because the voter did not put a date on there. For those who vote by mail, know there's a section, but when those ballots actually come to the County Board of Elections, they are timestamped. So it was clear that they were submitted before 8 p.m. on election day, within the rules. And the only thing they did was they omitted the date themselves. So then the legal argument became, should we throw these votes out that were submitted legally before 8 p.m.? It's just the person didn't write it themselves, declaring that it was, signed on the date before the election, but they were clearly received and timestamped by the Board of Elections. So I'm obviously, I don't have a Juris Doctorate. Obviously, our illustrious colleague Miracle does, but it seems to me that we shouldn't put the onus on the voter to be perfect when they basically follow pretty much the letter to the law, and to disenfranchise thousands of voters for a small mistake, not turning it in a week later, a week after the election. We can understand that kind of mistake, but this definitely seemed like something that was not worth disenfranchising thousands of voters in Allegheny County. But I'd like to give Ryan an opportunity to ask a question.
Yeah, absolutely. Thanks, Kahari. And yeah, thank you, Senator Brewster, for joining us tonight. Really appreciate it. And so I really wanted to ask you about what it was like, not only to be present for those unprecedented proceedings at that first swearing in ceremony, but to really be at the center of it, and also what was running through your mind when you ultimately decided, to just to leave and let it play out in that final court hearing that upheld your election, and really just what compelled you to make that decision at the time?
Well, that's a very good question, Ryan. And it's interesting how your mindset can change in the middle of an event. And so I'm sitting at my desk in the Senate chambers, and the way it's arranged, any new members being sworn in because of the pandemic, they were the only ones that had family there. Normally, as you know, 25 of the 50 senators are up for re-election. But there were new folks who, both D and R's, that were coming in. The families were sitting within 50, 60 feet of us. And, I had suspected that there might be some difficulty. We weren't sure. I had talked to Senator Corman the night before, and we can get into the inner workings of the Republican caucus if you want later. But to your question, I was prepared to have someone come over and say, "Why are you here, Senator? We're not swearing you in." And I probably shouldn't admit this on a live screen, but I was prepared to inform that person. I'm from McKeesport. I'm a mayor. We have a tough town. I'm
Right.
proud of it. I love it here. And we don't let people talk to us or other people like that. So unfortunately, Ryan, I had in my head that I was going to display some unreadiness. And it's just, I'm being honest with you.
Right.
So then the Democratic members were called up to be sworn in. Now you've got I think it was a Superior Court judge standing in the aisle waiting to swear us in. By this time, they had already removed the lieutenant governor from his position for the day. So he's up on the rostrum about 10 feet up from me. Senator Corman is between me and Lieutenant Governor. He's telling the judge, "Don't swear them in," as long as Senator Brewster standing here. Lieutenant and John Fetterman saying, "Swear them in." And then my mind changed, and I thought to myself, to remove the lieutenant governor was a disgrace, period. There's no reason to do that. And now I'm looking back at the families who have never been in the Senate chamber before, and you could just see the shock on their face. Then the Jim Brewster that thought he might want to express his unreadiness all of a sudden felt that I should do something. And I I pulled on Senator Costa's arm. I said, "Listen, Jay, I would prefer you just swearing in the 9 Democrats. I'll step aside and we'll do this another day." I even looked up at Senator Corman and Lieutenant Governor Fetterman, and I just sort of went like this, "Just give me a minute here." And, it's interesting. You've all been in a position where you're at an event and suddenly you're the only person that can make that event go better.
Mm.
You didn't come there that day thinking that. You didn't even plan. It was unscripted. I saw a situation that was definitely going to get out of hand, more than it already was. And Senator Costa said, "Well, if that's what you want to do." And so he pulled our caucus together. And keep in mind, they've been fighting so hard for me, as you know. And it was hard to tell them to stand down a little bit. And at that point, they swore in my colleagues. And I had to leave the chamber because I'm not an official senator at that point. And I just want to close, Ryan, on that point. I don't know that, but 2 or 3 people knew that there was a section in the Senate rules. The Senate, they actually said this, we don't have to swear anybody in that we don't want to swear in. It don't matter what the election was. Well, I can assure you, someone's going to ask me what my plans are for the future. We're going to change that section because that's exactly what they did. They didn't like the results. I won. She lost. That particular section was in the bylaws of the Senate because of things like there was an individual that was indicted but won his election and was convicted after he won. So naturally, you're not going to, seat someone or swear them in. It wasn't to be used because they didn't like, I got 69 more votes than their candidate. So we're going to work on that. But that's basically what happened, Ryan. And I can't tell you how much I appreciate the Democratic senators, Senator Costa, Senator Hughes, Williams, Senator Saros, John Fetterman. I mean, for him to be up there, there was really. I mean, think about this: in one of the greatest states in the union, in the greatest country in the world, we remove our lieutenant governor because somebody didn't like the vote count. That's simply unacceptable. And so that's, Ryan, as a sort of a quick summary of what happened.
That's really very insightful, Senator. I wanted to ask you the same question I asked Lieutenant Governor Fetterman last week. One of the things that I've noticed is, Act 77 was passed, with bipartisan support. Then as we went through the fall, obviously it began like this chorus of questions about the integrity of our election, and obviously that disinformation and misinformation has continued. Now, in the wake of your reelection and the results of the November election becoming clearer, it seems like there's a movement of folks who were very supportive of Act 77 last year, 2019 rather, seem to now want to reform that and create this environment that there's all these questions about the integrity of elections. So how concerned are you as a senator that potential policy that could have the impact of voter suppression could be advanced in this upcoming session in the Pennsylvania Assembly?
Well, I am concerned about it, and we're in the minority, as you know, and that's what this whole fight was about. It wasn't about me. I mean, most of the Republican senators are people that respect me, and I respect them. But there's a power struggle going on in the Republican caucus, and keep in mind, Corey, they're trying to get 33 votes, which veto override. That's what this is about. It wasn't about Jim Brewster per se. It was about the veto override. And so, to your point, we are going to have some very contentious committee meetings, and we will litigate this as far as we have to. We are not going to remove a process that takes away the ability for people, all people, any precinct, any county, to not be able to vote. That's just not the American way. And I am somewhat struck by the fact that, again, I'm sort of a big picture guy. This is America. There was an attack on democracy this past week, and both in Harrisburg and in Washington, and that's simply not acceptable. And we can disagree ideological on things, but to disagree on process when you know that it's going to hurt a certain group of people, that's not what we do in this country, and we're not going to let it happen. And we have redistricting coming up, which is kind of the same process. The majority party will find a way to massage the districts throughout the state so that they can win more seats, have veto override. I mean, I'm a little frustrated about this idea. Like, aren't we supposed to represent 12.5 million people? I mean, we represent our district. But when I vote on a bill, I try to understand the importance to the people that live in central part of the state, or in Philadelphia, or up in Erie. I was a mayor. I understand the importance of including everybody. And there are still people who feel that that's not what they want to do. It's really just that simple. And I think we're going to win that fight, even if we are in a minority. I still believe there are fair-minded people that on the Republican side as well, that are out there every day working as blue-collar workers with their fellow friends that are Democrats. I think they know that the right thing to do is to make it as easy and fair as we possibly can. And, you're right. Act 77 was bipartisan, but the Republicans supported it. And now all of a sudden they want to change the rules. And the Steelers would like to change the rules too. It's not going to happen. And, I see the sign behind you, right? So, I mean, look, we don't get everything we want all the time. But in a democracy, you always have the right to continue to try to accomplish your dreams. And you do it through a democratic process, which is the best in the world. And I believe there were some folks that got a little too far just lately. And we're going to have to pull those folks back and remind them that that's not us. And so it's a good question. It's a long answer. I don't know what we're going to be confronted with, but we'll probably end up in the courts.
And before you go out, I don't know if Miracle has another question, but I just felt compelled to ask you. I know one of your colleagues was implicated in the insurrection, at the Capitol. Do you have a comment on your colleagues, participation in that and their future, serving with you in the Senate?
Well, what I'm going to do with that, Courageous, is that law enforcement do their job. Yes, he was there. I don't know to what extent he was involved. That's the part that we haven't heard much about. But for anybody that was in that building, there are serious consequences for that. Now, I mean, as I said earlier, there were how many hundreds of thousands, 200,000-300,000 people there. I think we could all agree that they didn't all go there to break into the building. I mean, they wanted to have a peaceful protest. And as what happens when we see protests, there's always a handful of agitators. We don't know who they are. We don't even know they're coming. And whatever group is having the peaceful protest really gets criticized for what happened. I've had it happen in our area out here, whether it be we get protests now and again whenever we see a confrontation where a young person's shot and people want justice and they're allowed to do that. And we should permit that. And every now and again, you get a couple people that take it too far. I think that's what happened in Washington. As for my colleague, we're going to have to let it play out. Let's see what the FBI comes up with. It's interesting to me. There's no loss for witnesses. Instead, they've got thousands of people that want to give information. So we'll see how accurate the information is. So it's unfortunate. No question.
Yes, and just because you're referencing some of the protests and the unrest that's been happening over the summer, for a lot of people, you were elected, you have these 69 votes, and particularly for the African American community in McKeesport and Westmoreland. Do you have a message that you wanted to send to those folks, how they can contact you, how they can reach out to you, and how you're able so that you can be able to advocate and work on their behalf as well?
Yes, Miracle, that's a good question. I have a really good staff. I mean, and they've worked very hard, and that's what gets lost in these elections. I mean, they handle literally tens of thousands of emails, texts, phone calls, letters, but in fact, the pandemic. I mean, it was nice to hear the doctor. We end up trying to answer those kinds of questions. Now, we don't have enough background. We only relay what we know, factual, in terms of numbers and where you can go to get tests and so forth. But to your point, we get calls frequently. Hey, we had an incident in our community here, and we're not happy with how the local elected officials may be addressing it. Can you help us? We get involved with those. And because everybody has a right to make sure that the event is addressed fairly, legally, in protecting people's rights. It doesn't, and to me, Miracle, it doesn't matter what the issue is. I mean, as a former mayor, I had a very good relationship with really every group in town. And they knew if they wanted to protest, go see Jim. Let's get our permit from the police chief. And Jim and council will show up. And not that we knew a lot about the event, just to support the process, to let people know that you're allowed to do that. And the people that listen, I had my share of unfortunate deaths in my city in 7 years. Nothing pained me more. In many cases, I knew the victims. In some cases, I knew the perpetrators. And in most cases, I knew the family. So I'm trying to keep our group together and really get focused on core causes. And in some of these rallies, we'd have our ministerium would be there, our clergy, and they would talk about outreach to the families, and and really it was a productive event, and try to make our city proud of how we handle unfortunate events and not be a spectacle. So they're difficult jobs, and but we would get calls frequently, Miracle, about can we get involved in these kinds of events? Maybe somebody was terminated from their job, and they felt that it was for reasons that weren't fair. We try to interact with that. So we're not attorneys, we're not doctors, but we end up answering some of those questions or getting the experts to come in and help us. That's what's lost in these elections. People have no idea what they're running for. I mean, it's a 24/7 job. It's not uncommon to get a call at 3:00 in the morning. Senator, I need your help. Okay. Don't even know the person. Not even sure they got my number. I mean, in the business you're in, Ryan, Miracle, Kari, you don't get calls when you say, don't they realize almost everybody's in bed right now? But it's important to them. And these elections are about putting people in offices that have a passion to help people, whether they know them or whether they agree with them. This isn't some sort of a game that you can change the next day. You can change your mind. You're either going to help people or you're not. And my personal opinion on an issue is really irrelevant. It's the people I represent and making sure that they get a fair shot at accomplishing what their goals are and their dreams. Another long answer to there's no right. I wish there was a yes. You have any yes or no questions?
No, I think that was a great way to end just a very enlightening and insightful conversation about policy and also the palace intrigue in Harrisburg. Thank you so much for your service, Senator Brewster, and for taking the high road in a situation where we know that just the human reaction. I think you said to come a little bit unready. I like the way that you phrased that. I think that most people would feel that same way. So again, the newly seated, officially re-elected, upheld Senator Jim Brewster from the 45th District of Pennsylvania. Thank you so much for joining us. Looking forward to talking to you more in this very, very important legislative session that's coming up.
I thank all three of you, and I'll be happy to come back anytime you need me.
Awesome. We will be in touch. Thank you so much. And thank Allison as well for her help.
I will do that.
Yes, awesome. Thank you so much. And that was State Senator Jim Brewster from the 45th District, who has been in the news a lot. And we're now going to go to our final guest for the evening, Mayor Matthew Shorraw from Monessen, Pennsylvania. So we go from the Mon Valley to deeper into the Mon Valley. And he is the mayor who just helped implement historic non-discrimination ordinance in the city of Monessen. He is here to join us tonight to talk about it. Welcome, Mayor.
Thank you. Thanks for having me.
Yeah. So thank you so much for joining us. So let's just jump right into it. Talk a little bit about the genesis of this ordinance, what this ordinance is, and why is it's so important to the Monessen community.
Sure. So many people may know Monessen is a really diverse community just on the edge of Westmoreland County. And we started talking about this ordinance back in October and November. Other municipalities throughout the Commonwealth, I think we're at 64, adopted similar ordinances. So I wanted to explore the possibility of doing something in Monessen. The last time we did a non-discrimination ordinance was 1968, so it was definitely overdue. So essentially, this ordinance will create a Human Relations Commission in Monessen to educate the public on issues surrounding race, discrimination with race, age, gender, sexual orientation, disability, really the whole gambit, and it fills in loopholes that are currently in state and federal law that don't cover a lot of those issues right now. And so we're also hoping that by adopting this ordinance, we will encourage the General Assembly in Harrisburg to update their laws. So that's essentially the ordinance in a nutshell.
Great. Miracle?
Yes, and so I know you talked about the genesis being to get people in Harrisburg to change the laws. People who don't know, various elected officials have gone on record and have said that gender non-discrimination in Pennsylvania basically will not happen. And so right now it is technically legal, albeit immoral and unethical, to discriminate housing and jobs with people who are of the LGBTQ IA community. And so these ordinances are very, very necessary so that people can live, and work and create and raise families. And so how did this process occur? Mary, you said since 1968, that's a pretty long time. So how were you able to galvanize people to come on to do this vote? Because it seemed to happen very seamlessly from like an outsider's perspective.
Yeah, we didn't really have much pushback. No pushback from the community. I went and I talked to different groups, local groups such as the NAACP, community members that I know that are active within the community, and just to get their feel for this sort of thing. Being in a small town, when people are having to deal with different issues, especially with discrimination, and we're not naive. We know this stuff happens, especially in smaller communities, and it's really terrible to say, and we like to think that it doesn't happen here, but it definitely does. So talking to members of the community, getting a feel for what they think, and then talking with council members, and really the only discussion that we had about the substance of the ordinance, I think it was early November when I brought it to the floor. We were initially going to create the Human Relations Commission to be a legal commission that could go and present evidence in court and that sort of thing. And unfortunately, we just don't have the financial means to do something at that level. So the next best thing that came out of the discussion on council floor was to create it as an educational and advocacy group. So it will be a 5-member commission. And if you experience a discrimination event, then you could come to this commission, talk to them. They can recommend you to various groups, whatever the subject will be, whether it's the EEOC, the NAACP, or any other sort of advocacy group, to get your issue heard. And then the group can also educate the public on any topic within that ordinance, whether it's discrimination based on race, LGBTQ, anything of that sort, to get the conversation moving. Because in Monessen and a lot of other communities, people don't talk about this stuff, and we just sweep it under the rug and pretend that it doesn't exist, and it does. And what we've seen in Monessen and a lot of other places over the last year, after the George Floyd protests, we saw a lot more people speaking out about this sort of thing. Monessen had 6 peaceful protests in the summer last year, and it was just incredible to see all the different people that were involved, people that don't get involved ever in the city. So that was kind of, it was stemming from that. We created a police accountability board when all of that was going on. And so this is another wing of that, where also this Human Relations Commission can work with the police accountability board if there's a civil rights issue tied to that too. So it kind of goes hand in hand. But when we were talking about it, there was no pushback. Council was all on board. So I think that they all understand that this is something that needs to happen, that it's time. Like I said, 1968, the world was a very different place, yet we're fighting a lot of the same things that we were fighting then. So if the General Assembly isn't going to step up and do it, if the federal government isn't going to step up and do it, then we need to start with local government.
Ryan, do you have a question?
Yeah, absolutely. Yeah, thanks for joining us tonight. And I just wanted you to ask if you could speak a little bit about, I believe I saw that Monessen is the first non-Allegheny County municipality in southwestern Pennsylvania to pass this type of ordinance. So I just wanted to hear you speak a little bit about how, not just encouraging them to pass this at the state level, but how, this can really provide momentum for a lot of other municipalities in Westmoreland County and some of the other more rural counties in the area to kind of follow suit and adopt, similar policies.
Yeah, absolutely. I will say that I've already had a couple mayors reach out to me for a draft of the ordinance. So that's really exciting. And yeah, part of this was to encourage other communities. I'd love to see communities along the Mon Valley, Duquesne, McKeesport, all of them up and down the Mon to adopt something like this. In Westmoreland County too. I don't think that I realized that we were the first when we adopted this. So that was kind of a shock to me. But I do know that most of the municipalities are in central and eastern PA that adopted this. And then, of course, Allegheny County. So it's just incredible to me that no one else has adopted something like this. So I think that it would be absolutely huge if we could get all of our local municipalities, especially in the Mon Valley, to follow suit.
Yeah, I know organizations like Take Action Mon Valley are very, very active and, have been like pushing for more equity and justice and inclusion. So I really hope that between their advocacy and you creating this legislation ordinance, it really inspires elected officials that this now is really the time to create these changes, and that's how we create progress in the future. And I also wanted just as you were talking about, you said that you went and talked to different people in the community. How have you been able to establish community relations? I think for a lot of elected officials, that seems to be like a barrier. That's something that they're very like afraid to do, is like reach out, meet different people, hear various issues. So how have you been able to cultivate those relationships?
It helps for me. I grew up here. I'm a fourth generation. So I'm not really afraid to talk to a lot of Monessenites, especially the ones that I know, the community leaders that are really engaged and that also talk to a lot of other people. It's just keeping those lines of communication open for everything. I like to run things by people, try to get a sense of what they're thinking. So that it was just a natural thing for me to say, hey, I have this idea. I want to do this. Other places are doing this. Why can't we? What do you think? And like I said, people were really open to it. And I think that elected officials need to do better at talking to people, just meeting them where they are, whether you're sending them a Facebook message, you see them in the grocery store, you talk to them on the street, wherever it is. Most people appreciate you talking to them as people, not as constituents, not as voters, just as people, to hear their thoughts. And especially when you meet them where they are, I think that that's just the good rule of thumb. Just meet them where they are. And a lot of people, elected officials are sometimes like, well, I don't want to get bombarded by people because people could be angry sometimes, but a lot of times people just want to vent to you. They might know that you can't change something. Maybe it's above your position, but they want to vent. And then maybe you will think, well, no, I could change that. Let's do this, this, and this. So just meeting people where they are. And I think that that's how we've been able to get most things done in Monessen, is meeting them where they are and talking to them about it.
Awesome. And I really appreciate you, in your opening remarks, talking about how diverse, Monessen is. Actually, my father, had cousins from Denora. I'm familiar with Bell Vernon. Could you just talk a little bit about, maybe some of the misconceptions that folks have about the lack of diversity, in that neck of the woods? Yeah.
Well, Westmoreland County is pretty white, most of the county. Monessen is not, though. And I tell people, a lot of the communities like in Westmoreland County, Ligonier, Greensburg, Latrobe, compared to Monessen, we have less in common with them than we do with Duquesne and McKeesport and Pittsburgh and all the mill towns. Monessen's a mill town. So we still have that diversity here, not just in terms of race, but in terms of people's backgrounds with Italian and Irish and all the different ancestries. So we're really lucky that we've retained that despite Monessen taking a huge population hit over the years, and it's made us better. Sometimes it's a challenge because we all have to get along with each other, just like, the country does. But it's made us better, and people don't think of Monessen. Sometimes I think people forget where we are. They don't know if we're in Westmoreland County or Allegheny County, or we're in the middle of all of them. We're on this weird horseshoe curve on the Mon River. So across the river, I can see Washington County out of my office. 3 miles south is Fayette, 3 miles north is Allegheny, and we're in Westmoreland. So I joke that the people in Greensburg, which is our county seat, sometimes they forget that we're in Westmoreland County too, and they don't know what to do with us. But we're really lucky in the population that we have and the diversity that we have, and we need to help all of the people that live here.
Absolutely. Miracle?
Just want to thank you so much. And then for people who want to learn more about the ordinance, or for other elected officials who would like to see it, is it posted anywhere for people to read? Or if you want to plug, your your county website or city website, so people can move there as well. If you want to share any information.
So I will make sure it's not on the city website, but I will make sure that I put it up there tonight so people can look for it. So they could go to cityofmonessen.com. I'll put it under the public documents tab, so they could go there and check it out. It'll be a PDF, download it, copy it word for word. I don't care. It will be flattering to me if you copy it word for word. If local elected officials want to tweak it for their own communities, that would be fantastic. I'm happy to send them the Word file too, so they don't have to retype the whole thing. They could just reach out to me. The contact info is on the city website. I'd be happy to do whatever I can to get people to adopt similar legislation.
That's great. Well, thank you so much for joining us, Mayor Matt Shorraw from Monessen, Pennsylvania, one of the up-and-coming leaders in southwestern Pennsylvania. Definitely seems like you have a very bright future, so we're looking for all the incredible things that you're going to do for Monessen and many more other wonderful things in the future. So thank you so much for joining us. We look forward to continuing this conversation soon.
Thanks. I appreciate it. Anytime.
Thank you. Thank you. And again, that was Mayor Matt Shorraw from Monessen, Pennsylvania. So that was tonight's episode. Wow, for 2021, we've had some very, very heavy hitters, congressmen, lieutenant governors, mayors, state senators, people from Johns Hopkins University. So definitely starting off the year with a bang. Wow, just a lot of great conversation tonight. Wow, this was definitely one of my favorite episodes. No disrespect to the other episodes, but I thought this was just a great conversation tonight.
Yeah, we had a great conversation, and we'll engage more. We have the elected officials on to hold them accountable to the people that they serve, and we can, we have these conversations. We've done some. We can always do more, push harder, and we're always, here to hear your critique and your feedback. But yes, this is a really good show. Learned a lot of information about COVID-19 and the vaccines. Learned some more about the ordinance, and it's pretty cool how he was like, I'm gonna go put it up tonight so people can read what the ordinance says. And it's like, that's the kind of accountability and transparency I think that people would like to see from elected officials.
Yeah, absolutely. I think it especially, along that same lines when he was talking about that meet people where they are philosophy that he was really hammering home in response to one of those questions, I think is, really about as good of a political philosophy as you can have. Obviously, depending on the office you have, your ability to do so fluctuates to some extent as far as accessibility goes. But in general, I think that's a really good approach to, to holding public office in general. And it's showed in his case with being able to pass, this landmark legislation in southwestern PA with, I believe, a unanimous vote from the city council as well.
Absolutely. Yeah, no, it definitely shows, what you could do, being engaged in a civic process. It's always exciting to see young people staying in southwestern Pennsylvania, investing in their community. He looks like, Mayor Shorraw looks like he's the city councilman from Shadyside. You would never know that, he was, representing Monessen, PA. But again, looks can be deceiving. You can't judge a book by its cover. And I think having more, Matt Shorraws across southwestern Pennsylvania, would be a powerful thing as we try to, move forward, and implement new policies, and new things that can welcome new folks into the community and help spur, more economic development. Because it is shown communities that are more inclusive tend to be stronger economically, looking around the country as far as being welcoming. So, it's not only just the right thing to do, but it's probably the smart economic thing to do as well.
Yeah, and I believe we saw Duquesne Mayor Nesby in the chat. So we do have to have her on as well one of these days, because she's, been fighting for Duquesne and trying to get a lot of like policies changed, and has had a little bit more of a challenging time to get, more progressive legislation on the books. But it's that time. So here we go. Tomorrow at 2:00, we have what Black Pittsburgh needs to know about building Black power. About our political agenda with, our favorite, my personal favorite, Summer Lee, Carl, and the Rashad Bird song. I'm just going to be talking about, what does it look like to actually have demands on day one from this administration. Then on Wednesday, we're very excited. We don't have the flyer for this yet because we're still getting some of our guests. We're going to have a special inauguration episode of the One to Power Hour starting at 2, where we're going to be talking to different people around Pennsylvania about, what is the political agenda that they have and their hopes and dreams for the next 4 years, because, the work continues. Then Wednesday, 6:00, we have This Week in White Supremacy because, yeah. So we'll see you on Wednesday at 6. And then on Thursday, if you like the conversation that we had already about the vaccine, COVID-19, who should take it, how do you get it? We will have another round of Ask a Black Doctor Thursday at 7 p.m. with, the doctors from the Gateway Medical Society. We're very excited, to have them come on so you can ask more questions, figure out what age you should get the vaccine. Is it good for you and your family? Should one person get it? Should everybody get it at the same time? All those questions that you have, will be there. And I do also believe we may also have Blacklight this Friday. I'm not 100% sure. I do think this is the third Friday. So we'll also have our Blacklight show this Friday at 6 p.m. with special guest Alasia. She'll be talking about her music. So we have a jam-packed week for y'all. Please tune in. Please support. We put our Act Blue in the chat. Please donate. We are a 501c4 organization. We know elections are coming up. We have so much work that we have to do, and we need it. We need your financial support and contributions to do the work, to do the engagement, to do the education. So please donate if you can. And I will pass it back over to our illustrious host and the man behind One to Power, Ari Mosley.
I want to thank Dr. Amesh Adalja from the Johns Hopkins Ctr for Health Security for joining us tonight. I want to thank Pennsylvania State Senator Jim Brewster for joining us tonight. And last but not least, want to thank Mayor Matt Shorraw from Monessen, Pennsylvania, for joining us tonight as well. And on behalf of my illustrious co-hosts, Ryan White and Miracle Jones, I want to thank you for joining us for another episode of the One Hood Power Hour. And as Miracle said, catch us Wednesday at 2 p.m. for special inauguration coverage as well. So until Wednesday at 2, stay informed, stay engaged, and most importantly, stay safe. Thank you for joining us. See you Wednesday at 2 o'clock. Good night.